Question 1. Cost-benefit analysis shows that implementing a new, potentially engaging therapeutic recreation program for individuals with various mental health disorders could increase client participation and satisfaction. However, the TRS must determine the most responsible approach to introducing this program, considering the diverse needs and potential vulnerabilities of the client population. Option A. Conduct a thorough, individualized risk assessment for each client, considering their specific mental health diagnosis, current symptom presentation, and any known triggers or contraindications before recommending participation in the new program. Option B. Rely solely on the client's self-reported interest and comfort levels to determine their suitability for the new program, without further professional assessment of potential risks. Option C. Prioritize clients with less severe mental health conditions for the new program, deferring participation for those with more complex needs until the program's effectiveness and safety are more widely demonstrated. Option D. Immediately launch the new program to capitalize on the potential benefits, assuming that most clients will be able to adapt and that any adverse reactions can be managed reactively. The correct answer is A. Conduct a thorough, individualized risk assessment for each client, considering their specific mental health diagnosis, current symptom presentation, and any known triggers or contraindications before recommending participation in the new program. Explanation: this scenario is professionally challenging because it requires a therapeutic recreation specialist, TRS, to balance the potential benefits of an intervention with the inherent risks associated with individuals experiencing mental health disorders. The core of the challenge lies in accurately assessing individual risk tolerance, the severity and nature of the mental health condition, and the potential for exacerbation or harm during therapeutic recreation activities. A thorough risk assessment is paramount to ensure client safety and well-being, aligning with the ethical principles of beneficence and non-maleficence and regulatory requirements for client care. The correct approach, which involves a comprehensive, individualized risk assessment prior to implementing therapeutic recreation interventions for individuals with mental health disorders, represents best professional practice. This aligns with the standards of practice for therapeutic recreation, which emphasize client-centered care and the importance of tailoring interventions to individual needs, abilities, and risks. Regulatory frameworks, such as those governing healthcare providers and mental health services, mandate that professionals conduct thorough assessments to ensure client safety and to develop appropriate treatment plans. This approach directly addresses the potential for adverse events by proactively identifying and mitigating risks, thereby upholding the professional's duty of care. An incorrect approach that bypasses or inadequately performs a risk assessment is a significant regulatory and ethical failure. For instance, implementing a group activity without considering the specific triggers or coping mechanisms of individuals with anxiety disorders could lead to panic attacks or social withdrawal, violating the principle of non-maleficence. Similarly, recommending a high-intensity physical activity for someone experiencing a depressive episode without assessing their energy levels and motivation could result in discouragement and further withdrawal, contravening the principle of beneficence. Failing to document the risk assessment process and the rationale for intervention choices also represents a failure to meet professional documentation standards and can have legal ramifications. Professional decision-making in such situations should follow a systematic process. This includes 1. Gathering comprehensive information about the individual's mental health diagnosis, current symptoms, treatment history, strengths and limitations. 2. Collaborating with the individual and their treatment team, e.g., psychiatrists, therapists, to gain a holistic understanding of their needs and risks. 3. Identifying potential risks associated with specific therapeutic recreation activities, considering factors like environmental hazards, social dynamics, and the activity's intensity. 4. Developing a risk management plan that outlines strategies to mitigate identified risks, including necessary accommodations, supervision levels, and emergency protocols. 5. Continuously monitoring the individual's response to interventions and reassessing risks as needed. Question 2. The control framework reveals that a therapeutic recreation specialist is working with a client who has expressed a strong aversion to participating in a group activity that is considered a key component for addressing their social interaction goals. The client states they feel too anxious to join. What is the most appropriate course of action for the specialist to take? Option A. Explore the client's specific anxieties related to the group activity. Discuss potential coping strategies and collaboratively brainstorm alternative ways to achieve similar social interaction goals within or outside the group setting, while respecting their current comfort level. Option B. Insist on the client's participation in the group activity, explaining that it is essential for their progress and that they must learn to manage their anxiety through exposure. Option C. Immediately remove the group activity from the client's treatment plan and replace it with a solitary activity, assuming the client's anxiety is insurmountable. Option D. Encourage the client to simply try their best and hope that their anxiety lessens over time without further discussion or intervention regarding the specific fears. The correct answer is A. Explore the client's specific anxieties related to the group activity, discuss potential coping strategies, and collaboratively brainstorm alternative ways to achieve similar social interaction goals within or outside the group setting, while respecting their current comfort level. Explanation. This scenario presents a common implementation challenge in therapeutic recreation, where a practitioner must balance client autonomy with the need for appropriate intervention, all within the established professional scope and ethical guidelines. The challenge lies in respecting the client's expressed desire to avoid a specific activity, while also ensuring that the therapeutic goals are not undermined, and that the client is not unduly limited in their potential for growth and engagement. Careful judgment is required to explore the underlying reasons for the client's reluctance without being coercive, and to adapt interventions accordingly. The correct approach represents best professional practice because it prioritizes a client-centered, collaborative, and evidence-informed process. It involves active listening, empathetic exploration of the client's concerns, and a commitment to finding mutually agreeable solutions. This aligns with the core principles of therapeutic recreation, such as self-determination, dignity of risk, and the importance of the therapeutic relationship. Specifically, it adheres to ethical standards that mandate respecting client choice, while also ensuring that interventions are appropriate and beneficial, and that the practitioner acts within their scope of competence. The process of exploring alternatives and adapting the plan demonstrates a commitment to individualized care and ongoing assessment. An incorrect approach that involves overriding the client's stated preference without thorough exploration would be a significant ethical failure. It violates the principle of client autonomy and could lead to decreased engagement, distrust, and a compromised therapeutic relationship. Such an approach might also be considered paternalistic, assuming the practitioner knows what is best for the client without fully understanding their perspective or lived experience. Another incorrect approach, such as abandoning the therapeutic goal entirely without exploring alternatives or understanding the root cause of the reluctance, would fail to uphold the practitioner's responsibility to facilitate client growth and well-being. This could be seen as a failure to provide appropriate therapeutic services. A third incorrect approach, focusing solely on the activity itself without considering the client's emotional or psychological barriers, would be a superficial intervention that misses the opportunity for deeper therapeutic work. Professionals should employ a decision-making framework that begins with active listening and empathetic inquiry. This involves understanding the client's perspective, identifying potential barriers, and collaboratively problem-solving. The process should involve assessing the client's readiness for change, exploring their values and preferences, and then adapting interventions to meet their needs. This iterative process of assessment, planning, implementation, and evaluation, guided by ethical principles and professional standards, ensures that therapeutic recreation services are both effective and respectful of the client's rights and dignity. Question 3. During the evaluation of a client's progress in a therapeutic recreation program, what is the most appropriate documentation practice to ensure both client care and professional accountability? Option A. Documenting specific observable behaviors, client responses to interventions, and progress towards established therapeutic goals using objective language. Option B. Recording only the duration of the session and the names of the activities completed, omitting any information about the client's engagement or progress. Option C. Including personal opinions and assumptions about the client's motivations and future potential in the documentation. Option D. Briefly summarizing the session, focusing on general activities without detailing specific client responses or measurable outcomes. The correct answer is A. Documenting specific observable behaviors, client responses to interventions, and progress towards established therapeutic goals using objective language. Explanation. This scenario is professionally challenging because it requires the therapeutic recreation specialist, TRS, to balance the immediate need for comprehensive documentation with the ethical imperative of client confidentiality and the practical constraints of time and resources. The TRS must ensure that all documentation is accurate, objective, and reflects the client's progress and the interventions provided, while also safeguarding sensitive personal information. The potential for misinterpretation or misuse of documentation necessitates a rigorous and ethical approach. The correct approach represents best professional practice because it prioritizes accurate, objective, and timely documentation that directly relates to the client's therapeutic goals and progress. This aligns with the core ethical principles of the profession, such as beneficence and non-maleficence, by ensuring that the client receives appropriate and effective care based on well-recorded information. Furthermore, it adheres to professional standards and potential regulatory requirements for record keeping, which often mandate that documentation be factual, observable, and relevant to the services provided. This approach facilitates continuity of care, supports interdisciplinary communication, and provides a legal record of services rendered. An incorrect approach that focuses solely on brevity without ensuring completeness or objectivity would fail to meet professional standards and could jeopardize client care. It might omit crucial details about the client's response to interventions or their functional status, leading to misinformed treatment decisions by other professionals. This could also be a violation of ethical guidelines that require thorough and accurate record keeping. Another incorrect approach that includes subjective opinions or personal biases rather than objective observations would compromise the integrity of the documentation. This introduces the risk of misrepresenting the client's condition or progress, potentially leading to inappropriate interventions or even harm. Such documentation would not be considered professional or legally defensible. A third incorrect approach that neglects to document specific interventions and the client's response would prevent a clear understanding of the therapeutic process. This lack of detail makes it difficult to assess the effectiveness of the treatment plan, track progress, or justify the services provided. It also hinders effective communication with other members of the healthcare team. The professional decision-making process for similar situations should involve a systematic review of documentation requirements, ethical guidelines, and agency policies. The TRS should prioritize factual reporting, use objective language, and ensure that all entries are relevant to the client's treatment plan and progress. Regular self-assessment of documentation practices and seeking peer review or supervision can further enhance the quality and ethical integrity of record keeping. Question 4. The risk matrix shows a client experiencing significant social isolation, which is negatively impacting their emotional well-being and leading to reduced physical activity. The client expresses reluctance to join group activities, stating they don't know anyone and feel awkward. The therapeutic recreation specialist is considering several interventions to address these interconnected issues. Which approach best leverages the benefits of leisure participation to improve the client's overall well-being? Option A. Advise the client to focus solely on increasing their physical activity through individual exercise routines, deferring social engagement for later. Option B. Recommend the client engage in solitary activities like reading or listening to music at home to reduce immediate social pressure. Option C. Encourage the client to attend a large, unstructured social gathering without specific guidance or preparation. Option D. Facilitate participation in a structured, small group board game club with assigned roles and opportunities for light conversation, emphasizing shared goals and cooperative play. The correct answer is D. Facilitate participation in a structured, small group board game club with assigned roles and opportunities for light conversation, emphasizing shared goals and cooperative play. Explanation. Scenario analysis. This scenario presents a common challenge in therapeutic recreation, where a client's engagement in leisure activities is hindered by a perceived lack of social connection, impacting their emotional well-being. The professional must balance the client's expressed feelings with the potential benefits of structured leisure participation, requiring a nuanced understanding of how leisure impacts multiple dimensions of well-being. The challenge lies in identifying the most effective intervention that addresses the client's immediate emotional state while promoting long-term social and physical gains. Correct approach analysis. The correct approach focuses on facilitating a structured social leisure experience that directly addresses the client's stated need for connection. By introducing a group activity with clear roles and opportunities for interaction, the therapeutic recreation specialist leverages the inherent social benefits of leisure. This aligns with the core principles of therapeutic recreation, which emphasize using leisure to improve physical, emotional, and social functioning. The approach is ethically sound as it is client-centered, evidence-based, recognizing the benefits of social leisure, and aims to enhance overall quality of life. It respects the client's current emotional state while actively working towards positive change through a therapeutic intervention. Incorrect approaches analysis. One incorrect approach might involve solely focusing on the client's expressed reluctance without exploring the underlying benefits of the proposed activity. This could lead to a missed opportunity for therapeutic growth and reinforce a potentially negative self-perception. Ethically, this approach could be seen as a failure to advocate for the client's well-being by not providing a potentially beneficial intervention. Another incorrect approach could be to dismiss the client's feelings and force participation. This disregards the client's emotional state and autonomy, which are fundamental ethical considerations in therapeutic practice. Such an approach could damage the therapeutic relationship and create resistance, undermining the intended benefits of the leisure intervention. A further incorrect approach might be to suggest solitary activities that do not address the client's expressed need for social interaction. While solitary leisure can have benefits, it would not be the most appropriate response to a client feeling isolated and seeking connection. This represents a failure to tailor the intervention to the client's specific needs and goals. Professional reasoning. Professionals should employ a client-centered, strengths-based approach. This involves active listening to understand the client's concerns, assessing their current functional abilities and limitations, and collaboratively developing intervention plans. The decision-making process should consider the evidence-based benefits of leisure participation across physical, emotional, and social domains, and how these can be best applied to the individual's unique situation. Ethical guidelines and professional standards of practice, which emphasize client autonomy, beneficence, and non-maleficence, should guide all interventions. Question 5. The performance metrics show a consistent increase in client participation in recreational activities, yet qualitative feedback indicates a decline in perceived enjoyment and a sense of accomplishment. A therapeutic recreation specialist, TRS, is reviewing these findings and considering how to best interpret and address the situation. Which of the following approaches best aligns with best professional practice in therapeutic recreation, considering theories of leisure and recreation? Option A. Increase the variety of activities offered to cater to a wider range of interests, assuming that more options will naturally lead to greater enjoyment. Option B. Reevaluate the program's goals to ensure they are aligned with fostering intrinsic motivation, focusing on opportunities for client choice, skill development, and social connection, as suggested by self-determination theory. Option C. Implement a reward system for consistent participation to incentivize clients and boost overall engagement levels. Option D. Focus on documenting the high participation rates as the primary indicator of program success, as this demonstrates effective service delivery. The correct answer is B. Reevaluate the program's goals to ensure they are aligned with fostering intrinsic motivation, focusing on opportunities for client choice, skill development, and social connection, as suggested by self-determination theory. Explanation. This scenario is professionally challenging because it requires a therapeutic recreation specialist, TRS, to interpret subjective client experiences and translate them into measurable outcomes, aligning with theoretical frameworks while adhering to professional standards. The core of the challenge lies in moving beyond superficial observations to understand the underlying psychological and motivational factors influencing a client's engagement and satisfaction. The correct approach represents best professional practice because it directly applies a relevant theoretical framework, self-determination theory, to understand the client's intrinsic motivation and perceived competence. By focusing on autonomy, competence, and relatedness, the TRS can identify specific interventions that foster genuine engagement and well-being, which are key objectives in therapeutic recreation. This approach is ethically sound as it prioritizes client-centered care and evidence-based practice, aligning with the ethical codes of the profession that emphasize client welfare and professional competence. An incorrect approach that focuses solely on participation rates without exploring the quality of engagement fails to address the underlying psychological needs. This is ethically problematic, as it may lead to superficial interventions that do not foster long-term well-being or intrinsic motivation, potentially violating the ethical principle of beneficence. Another incorrect approach that relies on external rewards to increase participation overlooks the core tenets of self-determination theory, which emphasizes intrinsic motivation. This can lead to a dependency on external motivators, undermining the goal of fostering self-efficacy and autonomy, and could be considered a failure in professional judgment by not utilizing the most effective theoretical lens. An approach that prioritizes therapist-defined goals over client-perceived success neglects the principle of client autonomy, a cornerstone of ethical therapeutic recreation practice. Professional decision-making in such situations requires a systematic process. First, identify the core issue, low perceived engagement despite participation. Second, select an appropriate theoretical framework, e.g., self-determination theory, that explains the observed phenomena. Third, analyze the client's experience through the lens of the chosen theory, looking for evidence of autonomy, competence, and relatedness. Fourth, develop interventions that specifically target deficits identified within the theoretical framework. Finally, evaluate the effectiveness of interventions based on both objective measures and subjective client feedback, ensuring alignment with ethical principles and professional standards. Question 6. Regulatory review indicates that therapeutic recreation specialists must utilize client assessment techniques and tools that are appropriate for the individual's functional abilities and communication style. A client presents with significant cognitive impairment and limited verbal expression, making traditional verbal interview methods challenging. Which of the following assessment approaches best aligns with regulatory requirements and ethical best practices for this client? Option A. Administer a standardized verbal assessment tool, adapting questions as needed based on the specialist's interpretation of the client's responses. Option B. Rely exclusively on detailed reports from the client's primary caregiver to gather information about their functional abilities and leisure interests. Option C. Select a general leisure interest inventory that has not been validated for use with individuals experiencing cognitive impairments. Option D. Utilize a nonverbal assessment tool specifically designed for individuals with cognitive impairments and limited verbal communication, observing behavioral responses and preferences. The correct answer is A. Administer a standardized verbal assessment tool, adapting questions as needed based on the specialist's interpretation of the client's responses. Explanation. Scenario analysis. This scenario presents a common challenge in therapeutic recreation where a client's communication barriers necessitate the use of alternative assessment methods. The professional must balance the need for comprehensive assessment with the client's ability to participate and provide accurate information, all while adhering to professional standards and ethical guidelines. The challenge lies in selecting an assessment tool that is both valid and reliable for this specific client population and their unique needs, ensuring the assessment is not only informative but also respectful and empowering. Correct approach analysis. Employing a nonverbal assessment tool specifically designed for individuals with cognitive impairments and limited verbal communication is the best professional practice. This approach aligns with the ethical principle of beneficence, ensuring the client's needs are met effectively, and justice by providing equitable assessment opportunities. Regulatory frameworks for therapeutic recreation specialists emphasize the importance of individualized assessment and the use of appropriate tools that accommodate diverse client needs. This method respects the client's dignity and allows for a more accurate understanding of their functional abilities, leisure interests, and needs, which is crucial for developing an effective treatment plan. Incorrect approaches analysis. Using a standard verbal interview without modifications or alternative communication strategies fails to acknowledge the client's specific limitations, potentially leading to an inaccurate or incomplete assessment. This violates the principle of individualized care and could be seen as a failure to provide appropriate services as mandated by professional standards. Relying solely on caregiver reports without direct client involvement bypasses the client's right to self-determination and can lead to a biased or incomplete picture of their needs and preferences. While caregiver input is valuable, it should supplement, not replace, direct client assessment when possible. This approach may not fully capture the client's subjective experience, which is a core component of therapeutic recreation. Selecting an assessment tool designed for a different population or with no established validity for individuals with cognitive impairments introduces significant risk of misinterpretation and inaccurate data. This demonstrates a lack of professional due diligence and could result in an inappropriate treatment plan, potentially causing harm or failing to provide beneficial services, thus violating professional ethical codes and potentially regulatory requirements for competent practice. Professional reasoning. When faced with a client who has communication barriers, a therapeutic recreation specialist should first consider the client's individual needs and limitations. The decision-making process involves 1. Identifying the specific barriers to communication. 2. Researching and selecting assessment tools that are validated for the client's condition and communication style. 3. Considering the ethical implications of each tool, ensuring it promotes client dignity and autonomy. And 4. Collaborating with the client and their support system, when appropriate, to ensure the assessment is comprehensive and meaningful. The ultimate goal is to gather accurate information to develop a client-centered, effective intervention plan. Question 7. Strategic planning requires a systematic approach to developing therapeutic recreation programs. Considering the diverse perspectives of clients, their families, and facility administration, which of the following initial steps is most crucial for ensuring a program is relevant, effective, and ethically sound? Option A. Prioritizing program activities based on the TRS's personal experience and perceived client interests. Option B. Developing program goals solely based on administrative mandates and available budget. Option C. Implementing a program that has been successful in a similar facility without local needs assessment. Option D. Conducting a comprehensive needs assessment that actively involves all key stakeholders to identify needs, preferences, and barriers. The correct answer is D. Conducting a comprehensive needs assessment that actively involves all key stakeholders to identify needs, preferences, and barriers. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a therapeutic recreation specialist, TRS, to balance the diverse needs and expectations of multiple stakeholders' clients, their families, and facility administration while adhering to established program planning principles and regulatory guidelines. The challenge lies in synthesizing these varied perspectives into a cohesive and effective program that is both client-centered and operationally feasible. Careful judgment is required to prioritize needs, set realistic goals, and design a program that maximizes therapeutic benefit within available resources and ethical boundaries. Correct approach analysis. The correct approach prioritizes a comprehensive needs assessment that actively involves all key stakeholders. This aligns with the ethical principle of client-centered care, which is fundamental to therapeutic recreation practice. By gathering input from clients, families, and administrators, the TRS ensures that the program addresses actual needs and preferences, fosters buy-in, and is aligned with the facility's mission and operational capacity. This thorough assessment forms the bedrock for setting meaningful goals and designing a relevant and impactful program, directly supporting the regulatory framework that mandates evidence-based and client-directed interventions. Incorrect approaches analysis. One incorrect approach would be to solely rely on administrative directives for program planning. This fails to incorporate the essential client perspective, violating ethical standards of client autonomy and self-determination. It also neglects the unique needs and experiences of the individuals the program is intended to serve, potentially leading to an ineffective or even detrimental program. From a regulatory standpoint, this approach may not meet requirements for individualized treatment plans or evidence-based practice. Another incorrect approach would be to design a program based solely on the TRS's personal preferences or assumptions about client needs, without formal assessment or stakeholder input. This is ethically unsound, as it bypasses the client's right to participate in their own care, and can lead to programs that are irrelevant or misaligned with therapeutic goals. It also fails to meet the regulatory expectation of a systematic and data-driven program development process. A third incorrect approach might involve implementing a program that is overly ambitious and exceeds the facility's resources or staff expertise, without a realistic assessment of feasibility. While well-intentioned, This can lead to program failure, client dissatisfaction, and potential ethical breaches related to providing services that cannot be adequately delivered. It also demonstrates a failure in the program design phase to consider practical constraints, which is a critical component of responsible planning. Professional reasoning. Professionals should employ a systematic, multi-stage decision-making process for program planning. This begins with a thorough needs assessment, utilizing a variety of methods to gather data from all relevant stakeholders. This data then informs the development of SMART, specific, measurable, achievable, relevant, time-bound goals. Following goal setting, program design should focus on selecting interventions and activities that are evidence-based, client-centered, and feasible within the given context. Ongoing evaluation is crucial to ensure program effectiveness and make necessary adjustments, thereby upholding professional standards and regulatory compliance. Question 8. Compliance review shows that a therapeutic recreation specialist is planning a group art therapy session for a mixed ability population, including individuals with mild cognitive impairments and those with limited fine motor skills. The therapist has identified a complex mosaic project as the primary activity. The therapist is considering whether to pre-select specific roles or tasks for each participant based on their perceived abilities, or to allow participants to choose their own tasks within the mosaic project, even if it means some may struggle or require significant assistance. Option A. The therapist should assign specific, simplified tasks to each participant based on their diagnosed cognitive and physical limitations to ensure everyone can complete a part of the mosaic without frustration. Option B. The therapist should proceed with the complex mosaic project as planned, assuming that the challenge will be motivating for all participants, and only intervene if a participant expresses significant distress. Option C. The therapist should facilitate a brief discussion with the group about the mosaic project, offering clear explanations of different tasks involved, and then allow each participant to choose the tasks they feel most comfortable or interested in attempting, providing support and adaptations as needed. Option D. The therapist should abandon the mosaic project altogether and opt for a simpler, less engaging activity that requires minimal adaptation to avoid any potential for participant struggle. The correct answer is C. The therapist should facilitate a brief discussion with the group about the mosaic project, offering clear explanations of different tasks involved, and then allow each participant to choose the tasks they feel most comfortable or interested in attempting, providing support and adaptations as needed. Explanation. This scenario presents a professional challenge due to the inherent tension between client autonomy and the therapist's duty of care, particularly when working with diverse populations who may have varying levels of cognitive ability or understanding. The core of the dilemma lies in ensuring meaningful participation and enjoyment for all clients while respecting their individual needs and limitations. Careful judgment is required to balance these competing ethical considerations. The correct approach represents best professional practice because it prioritizes a client-centered and individualized approach to activity selection and adaptation. This aligns with the core ethical principles of therapeutic recreation, such as client autonomy, beneficence, and non-maleficence. By actively involving the client in the decision-making process and seeking their input, the therapist upholds their right to self-determination. Furthermore, adapting the activity based on observed cues and stated preferences demonstrates a commitment to providing a beneficial and safe experience, minimizing the risk of frustration or harm. This approach is consistent with professional standards that emphasize tailoring interventions to meet unique client needs and promoting engagement. An incorrect approach that fails to involve the client in the selection process, even with good intentions, violates the principle of client autonomy. Assuming a client's preferences without direct consultation can lead to disengagement and a lack of perceived value in the therapeutic process. Another incorrect approach that focuses solely on the most physically demanding or complex version of an activity, without considering adaptations for those with cognitive or physical limitations, risks alienating or excluding individuals, thereby failing to provide a beneficial and equitable experience. This could be seen as a failure to uphold the principle of justice, which calls for fair and equitable treatment. A further incorrect approach that prioritizes ease of facilitation over client engagement and enjoyment neglects the primary purpose of therapeutic recreation, which is to enhance well-being and quality of life through meaningful activity. Professionals should employ a decision-making framework that begins with understanding the client's individual strengths, limitations, preferences, and goals. This involves active listening, observation, and open communication. When selecting activities, therapists should consider a range of options that can be adapted to suit diverse needs. The process should be collaborative, with the client's input actively sought and respected. If initial choices are not successful, therapists must be prepared to observe client responses, gather feedback, and make necessary modifications to the activity or select an alternative, always with the client's best interests and autonomy at the forefront. Question 9. Implementation of a therapeutic recreation intervention designed to enhance community reintegration for a client with a history of substance use disorder, where the client expresses a strong desire to attend social events that may involve alcohol, presents a professional dilemma. The therapeutic recreation specialist must assess the client's readiness and capacity for managing potential risks while respecting their autonomy and goals. Which of the following approaches best reflects adherence to professional standards and competencies in this situation? Option A. Conduct a comprehensive risk assessment with the client, exploring their coping strategies, support systems, and understanding of potential triggers, and collaboratively develop a plan that includes gradual exposure to social settings with clear boundaries and relapse prevention techniques. Option B. Focus solely on educating the client about the dangers of alcohol and relapse, without engaging in a discussion about their specific social plans or offering strategies for managing potential risks in those settings. Option C. Allow the client to attend any social event they choose without further discussion, trusting their judgment and prioritizing their immediate desire for social engagement. Option D. Immediately prohibit the client from attending any social events where alcohol may be present, citing the client's history and the potential for relapse as overriding concerns. The correct answer is A. Conduct a comprehensive risk assessment with the client, exploring their coping strategies, support systems, and understanding of potential triggers, and collaboratively develop a plan that includes gradual exposure to social settings with clear boundaries and relapse prevention techniques. Explanation. The scenario presents a common challenge in therapeutic recreation, where a practitioner must balance client autonomy with the need to ensure safety and adherence to established professional standards. The core of the challenge lies in interpreting and applying the principle of client self-determination, when a client's choices may pose a perceived risk, even if the risk is not immediate or severe. This requires a nuanced understanding of professional competencies, including assessment, intervention planning, and ethical decision-making, all within the framework of established professional standards. The correct approach demonstrates best professional practice by prioritizing a comprehensive assessment of the client's capacity to understand risks and make informed decisions. This aligns with the core competencies of therapeutic recreation specialists, which include the ability to conduct thorough assessments, develop individualized treatment plans, and facilitate client participation in decision-making processes. Specifically, it reflects the ethical obligation to respect client autonomy while also ensuring their well-being, as often outlined in professional codes of ethics and practice guidelines. This approach involves open communication, collaborative goal setting, and a commitment to client-centered care, ensuring that interventions are both effective and ethically sound. Incorrect approaches fail to meet professional standards by either overstepping boundaries or neglecting the client's rights. One incorrect approach might involve unilaterally imposing restrictions without adequate assessment or client involvement, which infringes upon client autonomy and can undermine the therapeutic relationship. This disregards the competency of collaborative intervention planning and client empowerment. Another incorrect approach might be to completely defer to the client's wishes without considering potential risks or the professional's duty of care, which could lead to harm and a failure to uphold professional responsibilities. This neglects the competency of risk assessment and the ethical imperative to ensure client safety. A third incorrect approach might involve a superficial discussion of risks without truly exploring the client's understanding or capacity, which is a failure in both assessment and communication competencies. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's situation, including their strengths, needs, preferences, and capacity for self-determination. This is followed by an analysis of potential risks and benefits associated with different intervention options. The process should involve open and honest communication with the client, exploring their understanding of the situation and their choices. Collaboration with the client in developing and implementing the intervention plan is paramount. Finally, ongoing evaluation and adjustment of the plan based on client progress and evolving circumstances are essential components of ethical and effective therapeutic recreation practice. Question 10. The audit findings indicate that the current risk assessment protocols for therapeutic recreation programs may not adequately address emerging client needs and evolving environmental factors. Which of the following strategies represents the most effective approach to enhancing the risk assessment process? Option A. Conduct a comprehensive review and update of existing risk assessment protocols, incorporating client feedback, staff expertise, and current best practices in therapeutic recreation. Option B. Rely primarily on historical incident reports to identify potential risks, assuming that past patterns will accurately predict future safety concerns. Option C. Implement a policy to significantly reduce the number of activities categorized as high risk, regardless of their therapeutic value or client interest. Option D. Delegate the entire risk assessment and management process to administrative personnel to ensure consistency and efficiency. The correct answer is A. Conduct a comprehensive review and update of existing risk assessment protocols, incorporating client feedback, staff expertise, and current best practices in therapeutic recreation. Explanation. The audit findings highlight a critical need to reevaluate the risk assessment process within therapeutic recreation programs. This scenario is professionally challenging because it requires balancing the inherent risks associated with therapeutic activities with the ethical imperative to provide meaningful and engaging experiences for clients. A robust risk assessment is not merely a procedural step, but a foundational element of client safety, program efficacy, and regulatory compliance. The pressure to deliver services while managing potential liabilities necessitates careful judgment and a systematic approach to identifying, analyzing, and mitigating risks. The correct approach, which involves a comprehensive review and update of the existing risk assessment protocols to incorporate client feedback and emerging best practices, represents best professional practice. This aligns with the ethical standards of the therapeutic recreation profession, which emphasize client-centered care and continuous quality improvement. Specifically, regulatory frameworks for therapeutic recreation often mandate that programs be designed and implemented with client safety as a paramount concern, requiring ongoing evaluation and adaptation. Incorporating client feedback ensures that the risk assessment is relevant to the actual experiences and perceptions of those participating in the programs, leading to more effective and appropriate mitigation strategies. This proactive and client-informed approach minimizes the likelihood of adverse events and enhances the overall therapeutic value of the services provided. An incorrect approach that focuses solely on reducing the number of high-risk activities without considering their therapeutic benefit or client preference fails to meet professional standards. This approach might be driven by a misinterpretation of risk management as risk elimination, which can lead to overly restrictive programming that compromises client autonomy and therapeutic outcomes. Ethically, this could violate principles of beneficence and non-maleficence by failing to provide potentially beneficial interventions due to an excessive focus on avoiding all perceived risks. From a regulatory standpoint, such an approach might not adequately address the requirement for individualized care and program appropriateness. Another incorrect approach, which involves relying exclusively on historical incident data without proactive identification of new or evolving risks, is also professionally unacceptable. While historical data is valuable, it does not account for changes in client populations, therapeutic modalities, or environmental factors. This passive approach can lead to a false sense of security and leave programs vulnerable to unforeseen risks, potentially violating regulations that require ongoing risk assessment and management. Ethically, it demonstrates a lack of due diligence in protecting client well-being. Finally, an approach that delegates the entire risk assessment process to administrative staff without the direct involvement of qualified therapeutic recreation specialists is flawed. Therapeutic recreation specialists possess the unique knowledge and expertise to understand the nuances of therapeutic activities, client needs, and appropriate interventions. Delegating this responsibility can lead to an incomplete or inaccurate assessment, potentially overlooking critical safety considerations or therapeutic opportunities. This failure to involve subject matter experts can result in noncompliance with professional standards and regulatory requirements that expect qualified professionals to oversee program design and implementation. The professional decision-making process for similar situations should involve a systematic and iterative approach. Professionals should first understand the specific regulatory and ethical mandates governing their practice. Then, they should engage in a thorough assessment of the current program, identifying potential risks through a combination of methods, including client and staff input, environmental scans, and review of best practices. This should be followed by a clear process for prioritizing identified risks based on their likelihood and potential impact. Finally, strategies for mitigating these risks should be developed, implemented, and continuously monitored and evaluated, with a commitment to adapting the process as needed. Question 11. Process analysis reveals a therapeutic recreation specialist is working with a client who has shown significant initial progress in improving social interaction skills. However, over the past 3 sessions, the client's engagement and participation in group activities have noticeably decreased, and they appear withdrawn. The specialist has observed this trend and is considering how to best proceed to ensure the client continues to benefit from therapeutic recreation services. Which of the following represents the most appropriate next step in best practice evaluation? Option A. Assume the client has reached their maximum benefit from the current group activities and begin planning for discharge to allow other clients to utilize the group's resources. Option B. Conduct a comprehensive reassessment of the client's current functional abilities, barriers to participation, and perceived effectiveness of the current intervention strategies, followed by a review of the intervention plan based on these findings. Option C. Focus solely on identifying external stressors in the client's life that might be contributing to their withdrawal, without re-evaluating the therapeutic recreation intervention itself. Option D. Rely on anecdotal observations from the past few sessions to make a subjective judgment about the client's motivation, and adjust the intervention based on this personal interpretation. Correct answer is B. Conduct a comprehensive reassessment of the client's current functional abilities, barriers to participation, and perceived effectiveness of the current intervention strategies, followed by a review of the intervention plan based on these findings. Explanation. This scenario presents a common challenge in therapeutic recreation where a client's progress appears to plateau, raising questions about the effectiveness of the current intervention plan. The professional challenge lies in accurately assessing whether the plateau is due to limitations of the intervention, external factors impacting the client, or a need for a different approach, all while adhering to established professional standards and ethical guidelines. Careful judgment is required to avoid premature conclusions or misinterpretations of client progress. The correct approach represents best professional practice because it involves a systematic and comprehensive re-evaluation of the client's status and the intervention's efficacy. This aligns with the core principles of therapeutic recreation, emphasizing client-centered care, evidence-based practice, and continuous quality improvement. Specifically, it adheres to the ethical standards of the National Council for Therapeutic Recreation Certification, NCTR, which mandate ongoing assessment and evaluation to ensure interventions remain appropriate and effective. This approach prioritizes the client's well-being and maximizes the potential for positive outcomes by ensuring the intervention plan is responsive to the client's evolving needs and circumstances. An incorrect approach that relies solely on subjective observation, without systematic data collection, fails to meet the professional standard of objective assessment. This could lead to biased interpretations of progress and potentially inappropriate adjustments to the intervention plan, violating the ethical obligation to provide competent and evidence-informed services. Another incorrect approach that focuses only on external factors without re-evaluating the intervention itself neglects the therapist's responsibility to critically examine their own practice and its impact on the client. This can result in missed opportunities to modify interventions that are not yielding the desired results, potentially leading to a lack of progress and client dissatisfaction. An approach that assumes the client is no longer benefiting without a thorough reassessment also represents a failure to uphold professional responsibilities, as it bypasses the necessary steps to confirm such a conclusion and explore alternative strategies. Professionals should employ a decision-making framework that begins with a clear understanding of the client's initial goals and baseline functioning. When progress appears to stall, the next step is to conduct a thorough reassessment, gathering both subjective and objective data. This data should then be analyzed in conjunction with the original intervention plan to identify potential discrepancies or areas for modification. If the reassessment indicates that the intervention is no longer appropriate or effective, the professional should then explore alternative interventions or adjust the current one based on the new data and client feedback. This iterative process of assessment, intervention, and reevaluation is fundamental to effective therapeutic recreation practice. Question 12. The efficiency study reveals that a particular therapeutic recreation program has a high participant-to-staff ratio and a low cost per activity session. However, anecdotal feedback from participants suggests a decline in their perceived enjoyment and sense of personal growth derived from the program's activities. Considering the role of leisure in enhancing quality of life, which of the following approaches best reflects professional best practice for the therapeutic recreation specialist? Option A. Advocate for the continuation and potential expansion of the program, emphasizing that its efficiency metrics align with organizational goals for resource optimization, while also proposing a qualitative assessment to understand participant experiences. Option B. Recommend the immediate discontinuation of the program due to the reported decline in participant enjoyment and personal growth, despite its favorable efficiency ratings. Option C. Focus solely on the efficiency study's findings, arguing that the program's cost-effectiveness is the primary indicator of its success and value to the organization. Option D. Suggest modifying the program to incorporate more cost-effective activities that can be delivered with fewer staff, even if it means reducing the variety and complexity of the leisure experiences offered. The correct answer is A. Advocate for the continuation and potential expansion of the program, emphasizing that its efficiency metrics align with organizational goals for resource optimization, while also proposing a qualitative assessment to understand participant experiences. Explanation. This scenario presents a professional challenge because it requires a therapeutic recreation specialist, TRS, to balance the perceived efficiency of a program with its fundamental purpose, enhancing quality of life through leisure. The efficiency study, while providing data, may not capture the nuanced, individualized benefits of therapeutic recreation. Careful judgment is required to ensure that the pursuit of measurable outcomes does not overshadow the intrinsic value of leisure experiences for participants. The correct approach represents best professional practice because it prioritizes the core tenets of therapeutic recreation as defined by professional standards and ethical guidelines. It acknowledges that quality of life is a subjective and multidimensional construct, deeply intertwined with meaningful leisure engagement. This approach aligns with the National Council on Therapeutic Recreation Certification, NCTR, standards of practice, which emphasize client-centered care and the promotion of health and well-being through recreation and leisure. It recognizes that therapeutic recreation interventions are designed to facilitate individual growth, independence, and satisfaction, all of which contribute to an enhanced quality of life, even if these benefits are not always easily quantifiable in a short-term efficiency study. An incorrect approach that focuses solely on quantifiable metrics from the efficiency study, such as attendance numbers or duration of activities, fails to recognize the qualitative impact of therapeutic recreation. This approach risks devaluing the subjective experiences of participants, such as increased social connection, improved mood, or a greater sense of purpose derived from leisure. Ethically, this is problematic as it deviates from the client-centered philosophy of the profession and may lead to the discontinuation of valuable programs based on incomplete data. Another incorrect approach that prioritizes cost-effectiveness above all else, without considering the impact on the quality of leisure experiences, is also professionally unacceptable. While fiscal responsibility is important, it should not supersede the primary mission of therapeutic recreation. This approach could lead to the selection of less engaging or less beneficial activities simply because they are cheaper, thereby diminishing the therapeutic value and the potential for improved quality of life for participants. This violates the ethical principle of beneficence, which mandates acting in the best interest of the client. A professional decision-making process for similar situations should begin with a thorough understanding of the client's needs, goals, and preferences. This involves not only reviewing available data, but also engaging in direct observation, client interviews, and consultation with other professionals. When faced with conflicting data, such as an efficiency study versus qualitative observations, A TRS should advocate for a holistic assessment that considers both quantitative and qualitative outcomes. This includes articulating the value of therapeutic recreation in terms of its contribution to overall well-being and quality of life, even when those contributions are not easily captured by standard efficiency metrics. The decision-making process should be guided by professional ethics, evidence-based practice, and a commitment to client advocacy. Question 13. Investigation of how a therapeutic recreation specialist, TRS, should develop an individualized program plan for a client with a recent spinal cord injury, following a comprehensive assessment that identified significant limitations in fine motor skills, a desire to re-engage in painting, and a history of social anxiety. The TRS has access to adaptive art supplies and a small group art therapy program. Option A. Immediately enroll the client in the group art therapy program, assuming their desire to paint will override any social anxiety and that the group setting will naturally improve fine motor skills. Option B. Create a program plan that emphasizes passive art appreciation activities, such as visiting galleries, as direct participation in painting may be too challenging given the assessment results and the client's anxiety. Option C. Develop a program plan that includes one-on-one sessions using adaptive brushes and paints to address fine motor skill deficits, with the ultimate goal of enabling participation in the group art therapy program, and incorporate strategies to manage social anxiety during these sessions. Option D. Focus solely on activities that improve gross motor skills, as fine motor skills are unlikely to significantly improve, and postpone any art-related activities until the client is more physically able. The correct answer is C. Develop a program plan that includes one-on-one sessions using adaptive brushes and paints to address fine motor skill deficits, with the ultimate goal of enabling participation in the group art therapy program, and incorporate strategies to manage social anxiety during these sessions. Explanation. This scenario presents a common professional challenge in therapeutic recreation, where a therapist must translate assessment findings into a viable and effective individualized program plan. The challenge lies in balancing the client's expressed desires, the objective data from the assessment, and the practical constraints of available resources and professional scope of practice, all while adhering to regulatory and ethical standards. Careful judgment is required to ensure the plan is client-centered, evidence-based, and promotes meaningful outcomes. The correct approach represents best professional practice because it prioritizes a collaborative process that directly links assessment results to program goals and interventions. This aligns with the core principles of therapeutic recreation, emphasizing client autonomy and the use of leisure as a therapeutic modality. Specifically, it adheres to the ethical guidelines that mandate individualized service delivery based on thorough assessment and the development of measurable objectives. This approach ensures that the program is tailored to the client's unique needs, strengths, and preferences, maximizing the potential for positive change and engagement. An incorrect approach that solely focuses on the client's immediate requests without integrating assessment data fails to meet the professional obligation to provide evidence-based interventions. This can lead to ineffective programming that does not address underlying needs or promote long-term well-being, potentially violating ethical standards related to competence and due care. Another incorrect approach that relies exclusively on the therapist's assumptions, disregarding the client's input and assessment findings, represents a paternalistic model of care. This violates the ethical principle of client self-determination and can result in a program that is irrelevant or even detrimental to the client's goals. An approach that prioritizes readily available activities over those identified as therapeutically beneficial based on assessment results neglects the core purpose of therapeutic recreation, which is to facilitate health and well-being through purposeful intervention. This can be seen as a failure to adhere to professional standards of practice and a lack of commitment to achieving therapeutic outcomes. Professionals should employ a decision-making framework that begins with a comprehensive understanding of the assessment results. This understanding should then be shared and discussed with the client to collaboratively identify goals. Interventions should be selected based on their evidence-based efficacy in addressing the identified goals and tailored to the client's preferences and abilities. Finally, the plan should be documented, implemented, and regularly evaluated for effectiveness, with adjustments made as needed in ongoing collaboration with the client. Question 14. What factors determine the most appropriate standardized assessment instrument for a therapeutic recreation specialist to utilize when evaluating a client's leisure functioning and needs? Option A. The assessment that is most commonly used by other professionals in the facility, regardless of its specific relevance to therapeutic recreation. Option B. The assessment's psychometric properties, validity, and reliability, its relevance to the client's specific needs and goals, and its alignment with the scope of practice for therapeutic recreation specialists. Option C. The assessment that is quickest and easiest to administer, prioritizing speed over comprehensive data collection. Option D. The assessment that focuses solely on medical diagnoses and physical limitations, neglecting the psychosocial and leisure aspects of the client's well-being. The correct answer is B. The assessment's psychometric properties, validity, and reliability, its relevance to the client's specific needs and goals, and its alignment with the scope of practice for therapeutic recreation specialists. Explanation. This scenario presents a professional challenge because a therapeutic recreation specialist, TRS, must select an appropriate standardized assessment instrument for a client with complex needs. The challenge lies in balancing the need for comprehensive data with the client's specific condition, the availability of resources, and the ethical imperative to use valid and reliable tools. Careful judgment is required to ensure the assessment accurately reflects the client's functional abilities, leisure interests, and barriers to participation, ultimately informing a person-centered treatment plan. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based selection process. This involves considering the assessment's psychometric properties, validity, and reliability, its relevance to the client's presenting problems and goals, and its alignment with the scope of practice for TRS as defined by relevant professional organizations and regulatory bodies. For example, the National Council on Therapeutic Recreation Certification, NCTR, Standards of Practice and Code of Ethics emphasize the importance of using appropriate assessment tools to gather accurate information for planning and evaluating services. Selecting an instrument that is well-suited to the client's age, cognitive status, physical abilities, and cultural background ensures that the assessment is both effective and respectful. Incorrect approaches fail to meet professional standards and ethical obligations. One incorrect approach might involve selecting an assessment solely based on its widespread popularity or ease of administration, without considering its psychometric properties or suitability for the specific client. This could lead to inaccurate data, inappropriate treatment planning, and potentially harm to the client, violating the ethical principle of beneficence. Another incorrect approach might be to use an assessment designed for a different population or purpose, such as a purely medical assessment, without considering the leisure and recreation aspects crucial to therapeutic recreation. This would fail to capture the full spectrum of the client's needs and strengths, contravening the holistic approach mandated by the profession. Furthermore, using an outdated or unvalidated instrument would be a direct violation of professional standards that require the use of current, evidence-based practices. Professionals should employ a decision-making framework that begins with a thorough understanding of the client's individual needs, goals, and context. This should be followed by a review of available standardized assessment instruments, critically evaluating their psychometric properties, content validity, and appropriateness for the target population. Consultation with colleagues and supervisors, as well as staying current with professional literature, are also vital steps. The final selection should be a deliberate choice that best serves the client's interests and aligns with professional ethical and regulatory guidelines. Question 15. When evaluating a client's request to participate in a specific recreational activity that the therapeutic recreation specialist believes carries a higher risk than initially assessed, and which also conflicts with the specialist's personal comfort level, what is the most ethically sound course of action? Option A. Politely decline the client's request, explaining that the activity is not suitable based on professional judgment and offering alternative, lower-risk activities that align with the specialist's comfort level. Option B. Engage in a collaborative discussion with the client to explore their rationale, assess their understanding of potential risks and benefits, and jointly develop a modified plan or strategies to mitigate risks while respecting their autonomy. Option C. Insist on the client participating in pre-approved, standardized activities that have been deemed safe and effective, overriding the client's express preference. Option D. Immediately approve the client's request to avoid conflict and maintain a positive therapeutic relationship. assuming the client is aware of any potential risks. The correct answer is B. Engage in a collaborative discussion with the client to explore their rationale, assess their understanding of potential risks and benefits, and jointly develop a modified plan or strategies to mitigate risks while respecting their autonomy. Explanation. This scenario presents a common ethical challenge in therapeutic recreation, where a practitioner's personal values may conflict with a client's expressed desires, and the professional's duty to promote client autonomy and well-being. The core tension lies in balancing the therapist's professional judgment regarding safety and efficacy with the client's right to self-determination. Therapeutic recreation professionals operate under ethical codes that emphasize client-centered care, respect for dignity, and informed consent. The challenge is amplified when a client's chosen activity, while seemingly low risk to an observer, carries a perceived risk or goes against the practitioner's personal comfort level or interpretation of best practice. The correct approach prioritizes open communication, collaborative decision-making, and a thorough assessment of the client's understanding and motivations. It involves exploring the client's rationale, addressing any underlying concerns, and jointly developing a plan that respects their autonomy while mitigating potential risks to an acceptable level. This aligns with the ethical principles of beneficence, acting in the client's best interest, non-maleficence, avoiding harm, autonomy, respecting the client's right to make choices, and justice fairness in service delivery. By engaging in this process, the therapist upholds their professional responsibility to empower the client and facilitate their engagement in meaningful activities, even if those activities differ from the therapist's initial suggestions. Incorrect approaches fail to adequately address the ethical principles at play. One incorrect approach might involve unilaterally dismissing the client's request based on personal bias or a superficial assessment of risk. This violates the principle of autonomy and can undermine the therapeutic relationship by disempowering the client. Another incorrect approach could be to agree to the client's request without a thorough assessment or discussion, potentially leading to harm if the perceived risks are not adequately managed, thus violating non-maleficence and beneficence. A third incorrect approach might involve imposing a solution that does not genuinely reflect the client's preferences or needs, again disregarding autonomy and potentially leading to disengagement and a less effective therapeutic outcome. The professional decision-making process in such situations should involve 1. Actively listening to and understanding the client's request and rationale. 2. Conducting a comprehensive assessment of the client's capabilities, preferences, and the potential risks and benefits associated with their chosen activity. 3. Engaging in open and honest communication with the client about concerns, potential risks, and alternative strategies. 4. Collaboratively developing a plan that respects the client's autonomy while ensuring safety and promoting well-being. 5. Documenting the assessment, discussion, and agreed-upon plan. Question 16. Risk assessment procedures indicate that a newly hired therapeutic recreation specialist, TRS, needs to clarify the foundational understanding of their professional role. Which of the following best defines the scope of therapeutic recreation practice according to established professional guidelines? Option A. Systematic application of recreation and leisure interventions to address the assessed needs of individuals with illnesses and/or disabling conditions, aiming to improve their health and well-being. Option B. The provision of recreational activities solely for the purpose of enjoyment and social engagement, without a formal assessment or specific therapeutic goals. Option C. The exclusive focus on physical rehabilitation through recreational activity, disregarding cognitive, social, or emotional aspects of well-being. Option D. The general offering of leisure opportunities to individuals, irrespective of their health status or specific needs, as a means of filling free time. The correct answer is A. The systematic application of recreation and leisure interventions to address the assessed needs of individuals with illnesses and/or disabling conditions, aiming to improve their health and well-being. Explanation. This scenario is professionally challenging because it requires a therapeutic recreation specialist, TRS, to accurately define and delineate the scope of their practice within the established regulatory framework. Misinterpreting the definition or scope can lead to providing services outside of professional competence, failing to meet client needs effectively, or even violating professional standards and potentially legal statutes governing the practice of therapeutic recreation. Careful judgment is required to ensure all interventions are evidence-based, client-centered, and aligned with the overarching purpose of therapeutic recreation as a health profession. The correct approach represents best professional practice because it accurately reflects the definition and scope of therapeutic recreation as outlined by relevant professional organizations and potentially state licensure laws, assuming a U.S. jurisdiction for this exam. This approach emphasizes the systematic process of assessment, planning, implementation, and evaluation, a PI, of recreation and leisure interventions to address the assessed needs of individuals with illnesses and or disabling conditions. It recognizes therapeutic recreation as a profession focused on improving health and well-being through recreation and leisure, aligning with the core principles of the field. An incorrect approach that focuses solely on providing recreational activities without a therapeutic purpose fails to adhere to the definition of therapeutic recreation. It neglects the crucial element of addressing specific health needs and achieving measurable outcomes through planned interventions. This would be a regulatory and ethical failure as it misrepresents the profession and could lead to ineffective or even harmful service delivery. Another incorrect approach that limits therapeutic recreation to only physical rehabilitation ignores the broader scope of the profession, which encompasses cognitive, social, and emotional well-being. Therapeutic recreation is not solely about physical recovery. It is about holistic health and functional improvement through leisure. This narrow interpretation would be a failure to meet the diverse needs of clients and would violate the comprehensive definition of the profession. A third incorrect approach that defines therapeutic recreation as simply providing leisure opportunities for enjoyment without any assessment or goal setting fails to recognize the systematic, professional nature of the practice. Therapeutic recreation is not just about fun. It is a deliberate and planned process aimed at achieving specific therapeutic outcomes. This approach would be a significant ethical and regulatory failure, as it devalues the professional expertise and structured interventions that define therapeutic recreation. The professional decision-making process for similar situations should involve a thorough understanding of the current regulatory framework, professional standards of practice, and ethical codes governing therapeutic recreation. When faced with defining the scope of practice, a TRS should consult official documents from accrediting bodies, professional associations, and relevant state licensing boards. The process should always begin with a client-centered assessment to identify needs, followed by the development of a treatment plan that aligns with the established definition and scope of therapeutic recreation, ensuring all interventions are purposeful and goal-oriented. Question 17. Market research demonstrates a growing demand for adaptive kayaking programs within therapeutic recreation settings. A potential client, diagnosed with a moderate tremor condition, expresses strong interest in joining the upcoming adaptive kayaking program. While the tremor is generally well managed, the therapist has a general concern about the potential for instability in a kayak. The therapist has access to adaptive kayaking equipment designed to enhance stability. What is the most ethically and professionally sound approach for the therapeutic recreation specialist, TRS, to take in this situation? Option A. Allow the client to participate in the adaptive kayaking program without any specific modifications or further assessment, assuming the adaptive equipment will be sufficient. Option B. Deny the client's participation in the adaptive kayaking program due to the general concern about tremors and potential instability, without further assessment. Option C. Immediately refer the client to a physician for a definitive clearance for all water-based activities before any further consideration of participation. Option D. Conduct a thorough, individualized risk assessment specifically for adaptive kayaking, considering the client's tremor and the available adaptive equipment, and involve the client in developing a plan for safe participation. The correct answer is D. Conduct a thorough, individualized risk assessment specifically for adaptive kayaking, considering the client's tremor and the available adaptive equipment, and involve the client in developing a plan for safe participation. Explanation. This scenario presents a professional challenge due to the inherent tension between client autonomy and the therapist's duty of care, particularly when a client's perceived risk may impact their access to beneficial therapeutic recreation services. The therapist must navigate this delicate balance while adhering to professional standards and ethical guidelines specific to therapeutic recreation specialists, TRS, within the relevant jurisdiction. The correct approach prioritizes a thorough, individualized risk assessment that is directly linked to the proposed program's specific demands and the client's functional abilities. This aligns with best professional practice by ensuring that any limitations placed on the client are evidence-based, client-centered, and directly related to mitigating identified risks within the context of the program. It upholds the ethical principle of beneficence, acting in the client's best interest, by seeking to provide the service while ensuring safety, and respects client autonomy by involving them in the decision-making process. This approach is also consistent with regulatory frameworks that mandate individualized care plans and risk management strategies. An incorrect approach that immediately denies participation based on a general diagnosis without a specific, program-related risk assessment fails to uphold the principle of least restrictive intervention. It may also violate ethical guidelines regarding non-discrimination and equitable access to services. Regulatory failure could occur if the denial is not supported by documented evidence of a direct and unavoidable risk to the client or others within the program setting, as mandated by professional practice standards. Another incorrect approach that proceeds with the program without adequate risk assessment or modification, despite identified concerns, demonstrates a failure in the duty of care. This could lead to client injury, violating the ethical principle of non-maleficence, do no harm, and potentially resulting in regulatory sanctions for negligence or failure to implement appropriate safety protocols. Finally, an incorrect approach that relies on external opinions without independent professional judgment, or that imposes overly broad restrictions that significantly impede the client's ability to participate and benefit from the program, also represents a failure. This can undermine client autonomy and the therapeutic relationship, and may not align with the individualized and evidence-based approach required by professional standards and regulations. Professionals should employ a decision-making framework that begins with a comprehensive understanding of the client's needs, goals, and functional status. This is followed by a detailed analysis of the specific risks inherent in the proposed therapeutic recreation program. Therapists must then conduct an individualized risk assessment, considering the client's specific condition and how it interacts with program demands. Based on this assessment, appropriate modifications, accommodations, or alternative interventions should be explored to enable safe participation. Throughout this process, open communication with the client and, where appropriate, their support network is crucial. Documentation of the assessment, decision-making process, and implemented strategies is essential for accountability and professional practice. Question 18. Market research demonstrates a growing demand for therapeutic recreation services for children and adolescents with developmental delays in a specific region. A therapeutic recreation specialist is tasked with developing and implementing a new program. Considering the regulatory framework and ethical guidelines for therapeutic recreation specialists, which of the following approaches best addresses the implementation challenge of providing effective and compliant services? Option A. Utilizing a curriculum of pre-designed therapeutic recreation activities that have shown general success in similar populations, without conducting individual assessments, to ensure consistency and efficiency in program delivery. Option B. Focusing on providing a wide variety of recreational activities that are popular among children and adolescents, with the primary goal of increasing participation and enjoyment, and assuming that therapeutic benefits will naturally occur. Option C. Developing individualized treatment plans based on comprehensive assessments of each child's unique strengths, needs, and goals, utilizing evidence-based therapeutic recreation interventions, and regularly evaluating progress towards these goals. Option D. Implementing a structured program of adaptive sports and games, with activities chosen based on general developmental milestones for the age group, and providing opportunities for social interaction during these activities. The correct answer is D. Implementing a structured program of adaptive sports and games, with activities chosen based on general developmental milestones for the age group, and providing opportunities for social interaction during these activities. Explanation. This scenario presents a common implementation challenge in therapeutic recreation, balancing the need for evidence-based practice with the practical realities of resource limitations and diverse client needs within a specific regulatory environment. The professional challenge lies in selecting an intervention strategy that is both effective for the target population, children and adolescents with developmental delays, and compliant with the established standards of practice for therapeutic recreation specialists, TRS. Careful judgment is required to ensure that the chosen approach maximizes client benefit while adhering to ethical guidelines and any applicable state or national regulations governing therapeutic recreation services. The correct approach represents best professional practice because it prioritizes client-centered care, utilizes a validated and adaptable intervention, and aligns with the core competencies of a TRS. This approach emphasizes assessment, individualized planning, and the use of therapeutic recreation processes to achieve specific client goals. It is grounded in the understanding that therapeutic recreation is a systematic process, not merely the provision of activities. This aligns with the ethical principles of beneficence and non-maleficence, ensuring that interventions are designed to promote well-being and avoid harm. Furthermore, it respects the client's autonomy by involving them in the process, even at an age-appropriate level. Incorrect approaches fail to meet professional standards due to several regulatory and ethical shortcomings. One incorrect approach might focus solely on recreational activities without a clear therapeutic purpose or connection to individualized goals. This fails to adhere to the definition and scope of therapeutic recreation as a profession, potentially violating standards of practice that require goal-directed interventions. Another incorrect approach might overlook the importance of ongoing assessment and evaluation, leading to a static intervention that does not adapt to the child's progress or changing needs. This can be seen as a failure in professional responsibility and a deviation from best practices that mandate continuous monitoring and adjustment of treatment plans. A third incorrect approach might involve implementing interventions without adequate training or supervision, or without considering the specific developmental and cognitive abilities of the children and adolescents. This poses a risk of harm and violates ethical obligations to provide competent services. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's strengths, needs, and goals. This assessment should inform the selection of interventions, which must be evidence-based and aligned with the therapeutic recreation process. Professionals must consider the regulatory framework governing their practice, ensuring all interventions are compliant. Ethical principles, such as client autonomy, beneficence, and justice, should guide every decision. Finally, ongoing evaluation and documentation are crucial to demonstrate the effectiveness of interventions and to make necessary adjustments, ensuring the highest quality of care. Question 19. The risk matrix shows a moderate risk associated with introducing new adaptive technology for a client with limited mobility and cognitive impairment. Which approach best aligns with regulatory compliance and ethical best practices for a therapeutic recreation specialist? Option A. Immediately implement the most advanced adaptive technology recommended by the equipment manufacturer, assuming it will provide the greatest benefit. Option B. Rely solely on the client's family to select and implement any adaptive equipment, as they are most familiar with the client's needs. Option C. Conduct a thorough functional assessment of the client's current abilities and limitations. Research available adaptive technologies that address specific needs, trial the most suitable options with the client, and continuously monitor their effectiveness and safety. Option D. Avoid introducing any new adaptive technology due to the identified risks, and continue with traditional therapeutic recreation interventions. The correct answer is C. Conduct a thorough functional assessment of the client's current abilities and limitations. Research available adaptive technologies that address specific needs, trial the most suitable options with the client, and continuously monitor their effectiveness and safety. Explanation. This scenario presents a professional challenge due to the inherent variability in client needs and the rapid evolution of adaptive equipment and technology. A therapeutic recreation specialist, TRS, must balance the potential benefits of new tools with the client's safety, functional abilities, and personal preferences, all while adhering to established professional standards and ethical guidelines. Careful judgment is required to ensure that the integration of adaptive equipment and technology enhances, rather than hinders, the client's therapeutic goals and overall well-being. The correct approach represents best professional practice because it prioritizes a client-centered, evidence-based, and safety-conscious methodology. This aligns with the core principles of therapeutic recreation, which emphasize individual assessment, goal setting, and the use of appropriate interventions. Specifically, it adheres to the ethical standards of the National Council for Therapeutic Recreation Certification, NCTR, which mandate that TRS professionals act in the best interest of their clients, maintain competence, and use appropriate judgment in selecting and implementing interventions. The emphasis on client assessment, trial periods, and ongoing evaluation ensures that the chosen equipment is not only functional, but also suitable for the individual's unique circumstances and contributes positively to their therapeutic outcomes. This systematic approach minimizes risks and maximizes the potential for successful integration of technology. An incorrect approach that involves immediately implementing the latest technology without thorough assessment fails to uphold the ethical obligation to act in the client's best interest. This could lead to the selection of equipment that is too complex, inappropriate for the client's current abilities, or even unsafe, potentially causing harm or frustration. It also neglects the regulatory expectation for evidence-based practice, as the decision is not grounded in individual need or proven efficacy for that specific client. Another incorrect approach, which is to rely solely on the manufacturer's recommendations without considering the client's specific needs and the therapeutic context, is also professionally unacceptable. Manufacturers' guidelines are general and do not account for the nuances of individual client profiles, potential contraindications, or the specific therapeutic goals being pursued. This can lead to misapplication of equipment and a failure to achieve desired outcomes, potentially violating professional standards of competence and due care. Finally, an approach that avoids adaptive equipment and technology altogether due to perceived complexity or risk, without exploring potential benefits, is a failure to provide comprehensive and current therapeutic recreation services. This limits the client's access to potentially beneficial tools that could significantly improve their independence, engagement, and quality of life. It represents a lack of professional initiative and a failure to stay abreast of advancements that could enhance therapeutic outcomes, potentially contravening the ethical imperative to provide the most effective and appropriate services. Professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive client assessment. Understand the client's strengths, limitations, goals, preferences, and environmental context. 2. Research and evidence review. Investigate available adaptive equipment and technology, considering their efficacy, safety, and suitability for the client's needs. 3. Collaborative decision-making. Involve the client and, where appropriate, their family or caregivers in the selection process. 4. Trial and adaptation. Implement a trial period for new equipment, allowing for adjustments and modifications. 5. Ongoing monitoring and evaluation. Continuously assess the effectiveness of the equipment and make necessary changes to the intervention plan. 6. Documentation. Maintain thorough records of assessments, decisions, interventions, and outcomes. Question 20. The evaluation methodology shows that a client expresses a strong interest in participating in team sports, but also has a history of social anxiety and limited upper body strength. Considering the client's goals of improving social interaction and physical fitness, which of the following approaches to selecting a recreational modality would be most aligned with best professional practice for a therapeutic recreation specialist? Option A. Suggesting the client participate in a highly competitive team sport to push their boundaries and overcome social anxiety through intense exposure. Option B. Recommending a low-impact team sport that can be adapted to focus on individual skill development and gradual social integration, while also incorporating modifications to accommodate limited upper body strength. Option C. Prioritizing a team sport that requires significant upper body strength, assuming the client will be motivated to improve their strength through participation. Option D. Recommending a solo, non-physical activity that the client has previously enjoyed, as it is less likely to trigger social anxiety. Correct answer is B. Recommending a low-impact team sport that can be adapted to focus on individual skill development and gradual social integration, while also incorporating modifications to accommodate limited upper body strength. Explanation. This scenario presents a common challenge in therapeutic recreation, where a practitioner must select the most appropriate recreational modality for a client with specific needs and goals. The difficulty lies in moving beyond superficial understanding of modalities to a nuanced application based on client-centered principles and established professional practice guidelines. A deep analysis requires understanding how each modality can be adapted and facilitated to achieve therapeutic outcomes, rather than simply listing activities. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the client's individual strengths, limitations, interests, and goals. This aligns with the core ethical principle of client autonomy and the professional standard of individualized treatment planning. Therapeutic Recreation Specialist, TRS, practice, as guided by professional standards and ethical codes, mandates that interventions are tailored to meet specific client needs and facilitate desired outcomes. This approach ensures that the chosen modality is not only engaging, but also therapeutically relevant and contributes to the client's overall well-being and functional improvement. An incorrect approach that focuses solely on the client's stated preference, without considering therapeutic potential or safety, fails to uphold the professional responsibility to provide evidence-based and client-centered care. This can lead to ineffective interventions or even harm, violating ethical obligations to promote client welfare and avoid harm. Another incorrect approach that selects a modality based on the practitioner's personal expertise or convenience, without regard for the client's specific needs, demonstrates a lack of professional integrity and a failure to adhere to the principle of client-centered practice. This can result in a missed opportunity for therapeutic growth and may alienate the client. An approach that prioritizes a modality solely because it is readily available, without assessing its suitability for the client's goals, overlooks the fundamental purpose of therapeutic recreation, which is to facilitate meaningful change and improve quality of life through recreation. Professional decision-making in such situations requires a systematic process. First, conduct a thorough client assessment. Second, identify client goals and desired outcomes. Third, explore a range of potential recreational modalities, considering their therapeutic benefits and potential adaptations. Fourth, match the client's needs and goals with the most appropriate modality, ensuring safety and feasibility. And finally, continuously evaluate the effectiveness of the chosen modality and make adjustments as necessary. This iterative process ensures that therapeutic recreation interventions are always client-driven and therapeutically sound.